All right, for chapter 26, we're going to be talking about dental implants. And in this chapter, we're going to explain the considerations for dental implants, including patient preparedness. We'll list and describe the types of dental implants and explain the surgical procedures for placing the implants. We'll explain the steps in the treatment sequence, as well as discuss the post-operative home care and maintenance for patients with dental implants. So dental implants have a very good success rate. In fact, anterior teeth have a success rate that ranges from 90 to 100%. The posterior teeth has a 85 to 95% success rate. And the success also depends on the load that the implant carries. So for example, the anterior teeth have a 90 to 100% success rate because they're in the front. They don't tend to carry a lot of load. We don't do a lot of heavy duty chewing in the front teeth. Um, Whereas the posterior teeth are, we have still a pretty good percent success rate where it's 85 to 95%. The reason why that's a little lower is because we tend to beat up our back teeth when we're chewing and things like that. We tend to put a lot of load on those teeth. So that's why the success rate is just slightly lower there. Failure with dental implants is very rare, but it does happen, and there are some reasons for that. One of them is that the soft and or hard tissues may have infections or they're inflamed. Something happened that did not heal. The implant fails to integrate. What that means is these implants are basically these titanium screws that get screwed into the bone. And integration means that the bone actually grows around and locks in around the threads of the screw so that it locks it in place and so it doesn't move around at all. So if that fails to integrate, that means that that implant is free to move around inside that little socket that it made a home into the bone. And sometimes it can move around and cause issues. Or the implant fractures or breaks. It's very rare, and people don't tend to fracture or break their titanium implants. Let's say there is damage to the nerve in the mandible. For that reason, a dental implant would have to go. Or there is damage to the maxillary sinus or nasal cavity. Some considerations for dental implants are options that there are options that can be fixed or removable. They tend to improve the patient confidence, comfort, and social interactions just because they're a fixed prosthesis that doesn't come out at all, and it's always going to be with them. Patients should be in good health, though, and should have adequate jawbone and ample healing ability. If they don't have adequate jawbone, if they've lost a lot of bone due to not having teeth for a while or a severe periodontal disease, and or they have some type of issues with healing, let's say they have uncontrolled diabetes or something like that, that would be a contraindication for having implants. The assessment of bone density of the jawbone should be done prior to placing implants to see if there is enough bone density in those areas to hold that titanium screw. And also the patient should have a positive cooperative attitude. The treatment sequence takes anywhere from 2 to 6 months. It'll first start with the patient meeting and consulting with the restorative dentist. Then that dentist will more than likely refer them to a surgeon or a periodontist where they will have a diagnostic consultation with them. Their consent forms and financial arrangements are made between them and the patient. There's a surgical phase where the patient will go in and have the actual surgical placement of the implants. And then there is the restorative phase after that. So there's a couple of different techniques to do this. There is a one-stage technique and a two-stage technique. The one-stage technique, the implant is inserted into the bone and it protrudes through the tissue, and then the healing cap is placed on top. Then the healing cap is removed and the abutment post is placed. And then healing usually takes between 3 to 4 months for the bone to completely integrate. We call that osseointegration, where the bone locks into the threads of the screws. The two-stage technique is when the implant is placed in the bone, gingival tissue is sutured, and then this gingival tissue is sutured to cover the implant. Here, the healing takes place over a 3 to 4 month period, just like the one-stage technique. But then once it's healed, a second surgery is done to uncover the implant, check stability, and place a cap or abutment. After that is healed, the prosthesis is placed. I don't see hardly any of these two-stage techniques anymore. Most of the things, especially with a lot of the advancements of dental implant technology, and then the materials used for it, it's mostly going to be a one-stage technique these days. A lot of the healing abutments that they put on now will prevent enough infection to where that doesn't need to actually be sutured closed. It's just gotten a lot better. So we hardly ever see that two-stage technique once again. So there's different types of implants. A subperiosteal implant is used for patients who have alveolar bone that has worn away. And those are usually commonly placed in the mandible or the lower jaw. The endosteal implants are placed in the bone surgically. These implants may replace one or more teeth during a 1 or 2-stage insertion process. And then after the osseointegration state, the crown can be fabricated and placed on the dental implant. This is the most common type of implant. The mini implant or transitional implant were originally used as a temporary placement with until the real implant heals. Due to ease of placement, these are becoming more favored for specific types of restoration. So these are designed for stability in the soft and dense bone, and this implant can be placed through the tissue and into the bone. Post-insertion leaves the patient in less pain or discomfort than a standard dental implant. And it's used for retention, but it's not designed to replace osseointegrated dental implants. So here we have a dental implant. This is just a really large, blown up version of whatever you see here on the left, just so you can see the detail. Here we have those titanium threads on this titanium screw. And then this happens to have a healing cap that's placed on top. That's why it looks a little bit different than that one. So with post-operative care, the patient should only have clear liquids for the first 2 days. And then you want them to softly bite on gauze for 15 to 30 minutes just to stop the bleeding. You'll have them elevate their head for the first 2 nights and then rinse mouth with saline or warm salt water several times a day. They'll need to take a daily vitamin requirements, and then you want to have them contact the office if they have any concerns or questions. With the dental implant maintenance, we have to, just like any other teeth, we would have to remove the plaque and calculus on a regular basis. And then the condition of the gingiva or gum tissue and bone should be assessed regularly to make sure that there isn't any post-operative infections or anything like that going on. And then we want them to use have the use of aids for home care regimens, whether that be special things to clean their dentures with, or their implants with, and then just let them know what that entails. They still have to floss and care for those implants just like any other teeth, just because they still can accumulate lots of plaque and calculus. So with the implant retainer prosthesis, the fixed prosthesis procedure begins 6 months after surgery. Then after that, the impressions are taken, prosthesis is fabricated, and then the prosthesis is placed. And there are 2 types, and you'll see a picture of it in your book, where there is a screw retained and a cement retained crown. The screw retained are starting to be a lot more popular these days, mostly because with screw retained, you can easily unscrew the crown at any time throughout the patient's ongoing treatment, just in case something happens and that the implant needs to be retrieved. Whereas with the cement retained crown, you can still take the crown off, but you wouldn't be able to do it without completely destroying the crown first. You have to cut it off. So that there's some advantages and disadvantages with those as well. All right, so that's all I have for the implant, for dental implants. Please let me know if you have any questions. Thanks for watching.